with us. My name is Guzzardi. I'm state representative for the 39th District on the northwest side of Chicago, representing portions of Logan Square, Belmont Cragen, Portage Park, and Hermosa. I'm very pleased to be joined by some special guests and presenters this evening. We wanted to come together and share some information with members of the community about how to access certain state benefit programs. I'll talk a little bit more about that. We'll hear from the Department of Human Services to talk about these programs and go into detail about who can qualify for them and how to apply for them. All that great information is coming soon. But I'd first like to turn it over to one of our guests this evening to introduce himself and give us some context for this discussion. That's my dear friend and colleague, the Alderman of the First Ward, Daniel Spata.
Thank you so much, Representative Guzzardi. Yes, my name is Daniel Spata, Alderman of the First Ward, representing parts of Logan Square, Humboldt Park, Wicker Park, Westtown, and the East Village. And so glad to be here tonight for this really important conversation, because I remember the times in my life that I needed these services and both didn't have the courage or the wherewithal to access them. From the age of 21 to the age of 30, I did not go to the doctor once because I did not once have health insurance during that season. And I wish I could have gotten the benefits that I needed, because I remember how much needless pain and sickness and breaking down I went through during that time. I remember a lot of lunches when I was working part-time for $7.50 an hour that were just going to Panera Bread and getting a slice of baguette. And that was my lunch. Nights when my dinner was some frozen peas and some pasta, and calling that dinner. And there's probably a lot of folks listening who can relate to this. And I wish I had had the courage to ask for the supports and the services that I needed. And I wish I had had the information to know how to receive those services. And I hope you're watching this because you know you don't need to be ashamed to get the benefits and services that you deserve from the state of Illinois. And I hope that you're watching to get the information about how to access those services. We're so glad that you're here. And I'm going to toss this back now to the state representative.
Thank you. I appreciate that, setting the table here for our discussion. I also want to introduce my colleague in the Illinois legislature. She's a new legislator, but has already demonstrated tremendous passion and intellect and fight for our community. She represents the same area I do in the state Senate, as well as an adjacent district. Her name is Senator Cristina Pasiones-Zayas. Senator Pasiones-Zayas, welcome. Thanks for joining us.
Hi, thank you for inviting me. And I have to apologize that I will just be popping in to say hi, and really excited to see this type of information sharing in our community. It's really important. There's so many things coming down from the federal government with relief package, and it's really important that we have clear, accurate, accessible information so that we know how to take full advantage of these opportunities so that ultimately our communities can continue to thrive. We want to live beyond surviving, and this is really about thriving and having that collective social responsibility. So I really want to commend Representative Guzzardi as well as Alderman Spata for putting together this webinar, and then tomorrow it being in Spanish. So yay, 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 yay. And I'm sorry I can't stay for this because I have my town hall at 6:30. So we're getting together. I've got 2 Zooms going at the same time. So I wish you all the best and hope that everyone is able to get their questions answered and access those really key resources.
Thank you so much, Senator. We wish you luck in your your simultaneous event. I know we're all on lots of Zooms at the same time here. But before I turn it over to the department to make their presentation, I just wanted to say a few words about why I think this is such an important conversation for us to have, which is that, my view of our role in government, my role as a legislator, my colleagues' role, is that our job is to help create a society in which everyone's basic needs are met. That we have a collective responsibility, all of us, to chip in to make sure that people who are struggling are taken care of, and that there's a certain threshold below which you can't fall, and that children going hungry at night, people living on the street, families unable to get education for their kids. These are real failings of our society and failings that we ought not to tolerate. And I think, unfortunately, as Alderman Spata mentioned, there's been a sort of myth in the American culture that if you're unable to put food on your family's table, if you're unable to find stable housing, that's your fault, and that you have to own that responsibility and take the blame for that and handle that all yourself. And I think we can and should be better than that. I think we can be a community, a society where we take care of each other and where we all provide for one another, because we all know that each of us is going to need a hand up at some point in life, and each of us will be able to offer a hand up at another point. So I think that I think a purpose of this event is certainly to share with you all information about this, but also just to remind everybody that these programs are there and they're meant to be used, because they're there for folks who've fallen on hard times, and especially now more than ever, so many of us are struggling with unemployment, with instability. These programs are here to take care of people, and they're really important programs. And I think it's really important that our community be aware of them, and that folks who need them know that they can qualify and be able to take part in these programs. So with that, we're going to get into the nitty gritty here. What programs is Will talking about, and how do we access them? So for all of those details, I'm going to turn it over to the Department of Human Services, who's done us the kindness of joining us this evening and preparing a presentation for us. So thank you all so much for being here.
Thank you. Thank you all very much. Thank you, Alderman, Senator, Representative. We appreciate the invite. And we also appreciate the fact that you're taking this leadership initiative to get information out to community. So I'm going to go ahead and share my screen. Again, my name is Ahlam Jabara, and I'm with the Illinois Department of Human Services. The Illinois Department of Human Services, it has 5 divisions. Within the 5 divisions, the Family and Community Services Division is the largest division and literally services Illinoisans from like conception all the way to elderly, to burial and funeral services as well. We have been doing work at the local level, and I think that's a lot of what our community knows about. The Division of Family and Community Services has several programs. Our main programs are what we're going to talk a little bit about today. And again, it's a general overview, and it's not that detailed. We have our main programs, which are SNAP, the WIC program, Medicaid, and we have Immigrant and Refugee Services. And we're going to start off with our SNAP program. Our SNAP program, which used to be called the Food Stamp Program, and I think that's what it's known, that's the name it's known for the most, is basically a food program to help individuals and families who are low income have access to food. Basically, making sure the health and well-being of Illinois residents, adults, children are taken care of. We have several underlying programs as well, but initially, when somebody needs immediate food assistance, they will go and apply for SNAP. SNAP is a complicated program. So the main requirements for the program are income and expenses, and there's other nuances that come with it, which is how many people live with you, how many of you have income in that household. If you have a household of 4, is everybody working? So there's a lot of little nuances with that. the best way to figure out if you qualify is really to go onto our website and make sure that you look at the application, look at all the eligibility requirements, look at your income and your expenses, what programs that you need and you don't need, what you have and what you don't have. So it's very easily accessible at the DHS website. We also have a little tool that you can use, which is called the SNAP Eligibility Calculator. And an individual can go in and do an estimate, right? You put it in your rent, your expenses and so forth. And it can give you, it can tell you whether you qualify, whether you potentially qualify or not, and potentially how much you can make, how much benefits you can get with that. How to apply, we have several options for applications. You can apply online through our A website, which I'll share with you in a few minutes. You can go into one of our local offices, and our website actually has a local office locator where you put in your zip code and it will list all the local community offices that are in your area that you can go to. One of the things I did want to also share, and I'll probably say a few more times, is when somebody does have benefits, is making sure that they report any change of information, whether it's income, whether they've moved, if they've changed their phone numbers and so forth. That way your benefits can stay up to date and we can keep in communication with you. We also have within the SNAP program, and I'll talk about this briefly, and it's also a lot more complicated. There's a lot of other requirements, but we have our emergency SNAP benefits program. This means individuals who qualify for the emergency SNAP will have their benefits within 5 days. The purpose of it is really to make sure we get food on your table immediately, to ensure that you and your family have food immediately on your table. Sorry about that. So I've listed out some of the requirements. So say if you're eligible if your monthly income, cash and bank accounts are less than your rent or mortgage. And again, these are just top line requirements. There's like a month, your monthly income is less than $150, or your cash and bank accounts don't equal to $100. At least one person in your household is a migrant farm worker, and your cash and bank accounts are not more than $100. Of course, you have to have an ID. We need to have your address and so forth, just to ensure that we can get your benefits to you right away. Here I have listed just the basic income chart. So for somebody, like if I lived alone in my household, and I made less than $1,755 a month, I could potentially qualify for the SNAP benefit. Again, the SNAP benefit is a food program. It's for you to be able to buy milk and eggs, groceries, to ensure that your families and yourself have food in your home. So there's household, number of people in your household, there's how much income you're making, right? What your expenses are, and so forth. So there's a lot of eligibility requirements within that. And then we also have an estimated allotment for individuals, right? So the chart at the bottom, maximum monthly benefit, a household of one, qualifies for $204 a month. We do have, and I'll talk about this later, and I have it listed on this chart, there is, due to COVID, there is a 15% increase in the SNAP benefit program, but we'll go over that later. But originally, normally pre-COVID, normal household allotment for one person is 204, for two people is 374. And the chart is also going to be available on our website. Just quickly going through like how to apply again. I always emphasize there's multiple ways. There's our online system, abe.illinois.gov, or you can call also our toll-free hotline, a toll-free line, 800-843-6154. For individuals who have a hard time using technology, don't know maybe how to do everything online, call our hotline. We have caseworkers who are answering those phones, and you can actually apply on the phone if you can't use any kind of internet. Another option is also, just downloading an application from the internet. like physically filling it out and then bringing it into one of our offices. And I'll talk later more about where you can find our office locator on the website, and how you can actually get to one of our offices. We have offices all across the state, so no matter where you live, there's going to be an office that's nearby you. Due to COVID, we have a 15% increase in our SNAP benefits. So as I said earlier, a household size of one person normally got $204 in SNAP. Due to COVID, from January through June, those SNAP allotments are increased by 15%. So for somebody who's getting $204 normally is now getting $234. If it's a household of 5 people who are originally getting $807 in SNAP benefits, now they will be getting $929 in SNAP benefits. We also have our pandemic EBT, so our pandemic electronic benefits transfer. This is a special program as well, which started last year. Because of the coronavirus, we are students who are not in school full-time because schools are closed. They're remote learning, they qualify for the Illinois PEBT program if they are also part of enrolled in the free or reduced price school meals. I'm going to repeat that just one more time because I know there's been a lot of questions about this program. Eligible children for the SNAP benefit, the pandemic EBT program, qualify for the program if they're enrolled in the free or reduced price school meals. And their school is participating in the National School Lunch Program. They could also be enrolled in a community eligibility provision program, which also offers breakfast and lunch free to all students. I know also that schools that have majority low-income students, everybody in that school will also qualify for the pandemic EBT. The pandemic EBT for this school year, they're going to actually start sending out those pandemic EBT cards in March, so this month. And if you can see that picture on there, the SNAP pandemic program has a different color card. Our normal card is blue. As you can see here on the screen, it's normally blue. For the pandemic EBT program, the card is white, and it will have its own distinct number. So for those who are currently already enrolled in SNAP, they will be getting an Illinois PEBT card separately for the children who are enrolled in school and are enrolled in the free and reduced program. One of the things also that we do like to emphasize, and I know this has been also a question, is about where is the card going to be mailed? So first of all, let me backtrack a little bit. So one of the things is for this year, for this school year, you do not have to apply for this program. So the SNAP pandemic EBT program, you do not need to apply for. There is no application for this program. The Illinois Department of Human Services is working with the Illinois State Board of Education, and students who are enrolled in school and are enrolled in the free or reduced lunch program should be getting their cards in the mail. So there is no application process this year. Last year we had that, it was the first year that we did it. This school year, there's no application process for the program. So that's one thing that, I think is really great, and it's easier for the families. One thing that we do want to emphasize is ensuring that your mailing address is up to date. And that if you're not enrolled in the free or reduced meals program, you can check with your school and check if you're eligible to apply for it and enroll in it. And then you will be eligible to enroll in the SNAP PEBT program for this year. And here's just a little bit of information about when the benefits are going to be issued. So they are going to be issued for the whole school year, August through June. So families should start getting them this month, and it is by last name. And you can see here on the chart, and this is also online, first letter of child's last name, the A's should be going out on the 11th, and B's on the 12th. So it's between the 11th and the 22nd of the month, and it's going to be by last name. If you have any questions about this program, specifically the SNAP Pandemic EBT program, we do have a email address that you can send your questions to. And I'm sure each of the legislators will be getting this information as well in case anybody asks you. And it's dhs.fcs.pebt@Illinois, spelled out ILLINOIS.gov. So any questions about the PEBT program could be sent to this email address. Our second program, also a food program, the Women, Infant, and Children, a prominent program, but still underutilized, I think. Again, it's for ensuring that our families have the food and nutrition that they need. So the Women, Infant, and Children program is for pregnant women, breastfeeding moms, or just had a baby. It's for infants and children under 5 years old, and families with a low to medium income, up to 185% of the federal poverty level. Again, it's for purchasing food. Historically, the Women, Infant, and Children program, WIC program, gave out coupons. We've switched. We are now providing WIC participants with something similar to our link card. It's the WIC EBT card. Much easier process for families to utilize. And again, it's to buy, milk, juice, eggs, healthy foods for you and your children and infants. There's a lot of good education for pregnant moms and new moms. And there is a pre-screening tool that families can check to see if they qualify. And it's at the on the USDA.gov website. And this is just the benefits of the WIC EBT program. Since we've launched the program, there's also additional benefits to utilizing it. So individuals, families who are part of the WIC program now have more food choices, including wheat, tortilla, yogurt, and so forth. And a lot more options to go to locations to purchase WIC foods. Here's the income eligibility chart. Again, we follow the federal poverty level. So for a family of four, household of four, the annual income, $48,470 or less. Families may be eligible. Again, there's a lot of other eligibility requirements. We do recommend that you go online, check eligibility, and definitely reach out to one of our local offices. And again, you'll find those on our DHS website, which I'll keep sharing again and towards the end. Medical assistance. There are several medical programs, HFS and DHS partner on several of these programs. But the main program, or the famous program that a lot of people know of, and I'm sure there's a lot who don't know, is our Medicaid program. But the medical programs the state offers are about giving access to quality health care to all Illinois residents, right? Of course, for any of these programs, you have to fill out an application. There's eligibility requirements. It is complicated. We're doing the best we can to get information out to families. So there's a Medicaid and All Kids programs for low-income people of all ages. And we'll look at a chart shortly on that one. And really it's about making sure that families, individuals are getting the health care they need, the regular checkups at the doctor offices, getting the medications they need, the hospital visits. As I said earlier, there are several programs. Again, this is kind of like some of the programs and some of the requirements of each program. And I know it's complicated. And I'll talk later also about at the end, where there's organizations that you can reach out to get more information or get help walking through the process. The All Kids program has a lot of sub-programs. I've shared some of them here. It's the family care, the adult ACA program, which is the Affordable Care Act program. There's an All Kids Assist, All Kids Share. Again, several more. You can find those also on the Illinois.gov website or by calling the 800 number. And our caseworkers can definitely walk you through what programs are available and the eligibility requirements for those. There's our Medicaid program. So a person for the Medicaid program would have to be blind, disabled, 65 or older, have children under the age of 19, pregnant women, and meet, of course, the federally poverty level income guidelines. Our ACA adult Medicaid program, this is a more recent program from the Affordable Care Act. So there's also income guidelines here. You know, are you enrolled in Medicare or not? The good thing about this is that there is no asset limit. Again, a lot more nuance. This is just top line requirements. And then we have the AABD Medicaid program, aid to the aged, blind, and disabled. Persons, you know, are enrolled in Medicare, have a certain income, so within the 100% poverty level. There is a resource and asset limit, which is $2,000 for an individual. And we have a new program that my colleague Lillian Jimenez will talk in more detail about later on in the presentation. It's a new program. It's health benefits for immigrant seniors 65 and over. Requirements for that, you know, is they have to be Illinois residents. They're not eligible for Medicare or traditional programs. There's household income limits, resource limits, and there's other limits that and other requirements that Lillian will share later on today. But this program can also be applied for on our abe.illinois.gov website, or again by calling our 800 number. Other programs, there is a temporary medical card that individuals can use if they have applied for Medicaid, but haven't received anything. They've been waiting 54 or more days. Received a notice of possible entitlement to temporary medical assistance. You can get more information about the program by calling the All Kids program line, which I have here as well. It's 877-805-5312, or going onto the abe.illinois.gov website. And you can also contact our local offices. And we have our Moms and Babies programs, which again provides a full range of health benefits to eligible pregnant women and their babies up to 1 year age. Again, has income guidelines and other eligibility requirements. I know I'm going through this really fast. So at the end, we'll be more than happy to answer questions. This is the 2021 income limits guidelines for the different programs. So you'll see here, again, we have several programs. We have our AABD, there's our SNAP, our TANF, you know, all the All Kids programs, the Family Care, ACA. This chart is also available online, and our staff and our caseworkers can also kind of guide you through it as well. I'm going to hand it over now to my colleague Lillian Jimenez to talk about our immigrant refugee services, but we'll be answering questions at the end of the presentation as well. Thank you very much.
Hi, everyone. Thank you so much. That was so much information and an overview of all of our services and programs. I wanted to go over a little bit of the Office of Welcoming Centers. It was created a year ago and was based on the Bureau of Refugee and Immigrant Services and the work that was done in the past couple of years since 2017, and before that to provide services for immigrants and refugees. Go to the next slide. So who is eligible for these programs? Well, we have a range of eligibility. Mostly we have to keep in mind, definitely it's for low income immigrants, refugees, and limited English proficient individuals. But also there's a range of immigration statuses, and we're aware of that. And we understand that people may be in, US residents, US citizens, or they may be DACA recipients, which is Deferred Action for Childhood Arrivals, or they may be without any specific status, or undocumented. And so our goal in the Office of Welcoming Center is to connect the family with the services and programs that best meet their needs and fit the eligibility. We recognize that every family has different unique needs, different immigration status. There's a lot of mixed families, so people with US citizens, but also non-US citizens in the same household. And that does get a little bit confusing for folks about what their eligibility is. So we're here to help sort that out. And we have the language and cultural competency to assist our families. So, go ahead, next slide. So to start, we have 31 welcoming centers, and that is, again, thanks to the state representatives and state senators that are here and have supported the welcoming centers for so long. Representative Guzzardi being a great supporter. And we have recently gone from 17 community-based organizations to 31 community-based organizations. The Welcoming Center is a community-based model. That means we partner with those 31 agencies and they provide direct services in the language that is best suited for the immigrant population or refugee population. The goal of the Welcoming Centers is to provide comprehensive services and eliminate systemic barriers. And also to look at it in a holistic case management and service coordination model. Next. So we also have the Immigrant Family Resource Program, IFRP, which has been around even longer than 2017 and is able to provide assistance in 59 different languages. The Illinois Coalition of Immigrant Refugee Rights is the partner. They administer the 35 community-based organizations that provide services. So the idea is that you go to one of these organizations, a welcoming center or an immigrant family resource program provider, and they can sit down with you, provide case management, find out what the needs of your family is, ask you questions, answer your questions, and determine what they can do to help you receive services. So they do provide interpretation and translation. They will connect you to services such as TANF, SNAP, Medicaid, or childcare. And they also do outreach and community education because a lot of immigrant communities, if they're new, immigrant refugees, if they're new to the state, they may not be aware of what services are available. They may not be aware that of any programs that are available for their children, young people who may be in need of services and healthcare. So these organizations will provide case management, benefit screening, and also provide you with information about the public charge rule. We have a lot of questions coming to us from immigrants and refugees about whether they accept assistance in this difficult time of COVID financial hardship. If they accept assistance from the state, will this impact their ability to become U.S. Legal permanent residents and U.S. citizens at a future date when they become eligible? So our Immigrant Family Resource Program really is a go-to. They have developed an expertise, Illinois Coalition for Immigrant Refugee Rights has developed an expertise and is able to answer those questions that are unique to each household. We also have the New Americans Initiative, which is a program that funds citizenship and DACA services. So this program, through the 49 community-based organizations and the Illinois Coalition for Immigrant Refugee Rights oversees this program, provides English language classes, citizenship preparation, civic education, and legal guidance and application preparation. So for folks who are eligible for deferred action for childhood arrivals, which provides someone with employment authorization and protection against most forms of deportation, this program will be able to help the young people who are eligible. They may be young people who came to this country undocumented as young people, and may now be eligible for the deferred action for childhood arrivals. There was a lot of questions that came up over the last couple of years with the federal administration on whether or not this program was going to continue, whether or not someone was eligible, if new applications were being accepted. And this community model that the Illinois Coalition of Immigrant Refugee Rights has developed really is helpful in reaching, hard to reach communities that don't necessarily know to come to the state office, but they can come to their local community-based organization right there in their community, in their neighborhood, and ask these questions and get these services. And as a result, we've had thousands of people who have become U.S. citizens since this program began. A newer program is the Illinois Access to Justice program. I think this program is also very relevant and interesting. It's not specific. It is specific to immigrants, but it also has a wider, broader goal. It's an Illinois statewide program that seeks to mitigate the devastating consequences of incarceration and family separation. So there is a community-based model again. So Illinois, the IDHS partners with the Access to Justice, who is the Resurrection Project, and the Westside Justice Center, the two organizations that oversee actually 60 plus organizations that work with us to provide community-based legal services. And although it is a legal program, this program also seeks to connect people to social services, case management, referrals, outreach, and all types of assistance, so that folks who may be justice involved receive the services that they would not normally receive, to get back on their feet and to be successful. This program really targets two broad audiences, which is one, folks, justice involved folks who may have been impacted by incarceration, and then immigrants who may have been impacted by family separation. So they may be at risk of deportation or have immigration cases, and they wouldn't otherwise have any access to legal representation. And so I wanted to mention, we've been working the last 8 months on a host of COVID relief programs. We're very proud of the work we've been able to do to push out rental and utility assistance to families. $20 million was earmarked for immigrant, refugee, and LEP individuals. We also had, in addition to those 20 million, another 20 million that was earmarked for cash assistance. So one pot was for mortgage and rental assistance and utility assistance, and the other one was for cash assistance that could be used for emergency medical care, food, and other needs in the community. So just a little review just here. I'm very proud of the work that we've done through our community-based organizations to provide this rental and mortgage assistance to so many families. So I have a list here of how many people were impacted, and we are continuing that work. And I want to let everybody know here that the eviction prevention is at the top of our priority list, because we know that our communities have been impacted, disparately impacted by the COVID unemployment and financial hardship that has hit all of Illinoisans. And so we are continuing to partner with IDA and with IDHS and Continuums of Care to have a holistic eviction prevention program that includes legal assistance in eviction court, and direct rental assistance and utility assistance. So we're proud to be part of a wider Illinois wide program that will be offered to all Illinoisans. And our little piece of it is to make sure that immigrants and refugees have the language assistance so that they can also be part of this program for all Illinoisans. So please be on the lookout for that. So also wanted to just mention, if folks want to reach us, we do have a phone, email established so that you can reach out to us directly from 8:30 to 5 Monday through Friday. But if you leave a message, we will return your call within 24 hours, and we will assist you with any of your questions regarding SNAP, WIC, or TANF, and other public benefits, and refer you to any other social services that you might need. Health, we've referred people for different health resources, employment resources, and we'll locate the closest welcoming center or IFRP partner that is near where you live, so that you can also build a relationship with your local organization. So here are our websites. I know you can't click on them from a PowerPoint, but if anybody wants this information, perhaps we can put it in the chat so you can connect directly to us. Thank you.
Thank you, Lillian, and thank you, Alam, for your presentations. My name is Emily Melby, and I'm a staffer with State Rep Will Guzzardi. While we don't have many active questions in our chat, I wanted to bring up a few questions that have reoccurred from constituents who have come into our office seeking assistance. My first question is for Alam, and it is, could you please refresh our memory and remind us what the average wait time is for folks who apply for SNAP benefits and WIC benefits, as those are the two programs we see most folks utilizing in our districts?
It does take up to 45 days for the SNAP program. The WIC program, I will get back to you on that. I know it's a little bit faster, might be 30 days, but it does take up to 45 days, because it is a process from when we get the applications and we have to process them, check eligibility and so forth. It does take a while.
Thank you. And one other question for you. If someone applies for benefits and maybe they entered some information wrong, they got confused and their benefit application was denied, is there a way for them to appeal that decision to try to correct that information and still seek benefits?
Yes, definitely. We do have an appeal process. And Emily, I will send you the email link for the appeal process, and hopefully you can share that with your constituents.
Will do. Thank you so much. Our final question is for Lillian. Lillian, could you please remind us where folks can access information for their nearest Illinois Welcoming Center? And tell us if those centers are currently open with COVID, or are they by appointment only, or how that's working right now, just given the current public health situation.
Yeah, so on the previous page, we have the link on our website where you can go and look at our 31 agencies to see which one is closest to you or which one has your language. For example, we have many that speak Spanish, but we also have some that speak Arabic, Rohingya, you know, all the different languages that we have in the state of Illinois. So I would encourage people to look on there. If that's not possible, please do feel free to call us directly at our number. And we do, and we do it all the time, connect people directly, you know, make sure that we have that warm handoff and we talk to the Welcoming Center and have an introduction. So we'd love to do that for anybody who's listening to this, who's interested. And if you want to peruse the list yourself, you can go on our link here. There's a hyperlink here, but the bottom one, I did paste the actual website because I thought maybe people wouldn't be able to click on the hyperlink. And you can just go on the IDHS page and also just search for Welcoming Centers and find us that way. And we definitely will connect you to your closest Welcoming Center. We have a number in Chicago and Cook County, but we also have Welcoming Centers throughout the state of Illinois, in Carbondale and Champaign, in Rockford, in Quad Cities. So please just connect with us and we will connect you to your closest Welcoming Center.
Now, I'm going to add, if I can add, I'm sorry. We do have, again, I want to encourage people to go ahead and go onto the DHS website and kind of peruse it a little bit and look through it. There's a lot of resources on there. And of course, you know, we're definitely going to be sharing this this information and as much as we can with our state legislators and our local legislators to make sure that they have the information the constituents need as well.
Oh, and I forgot to mention, you asked about availability. So a lot of our offices are opening throughout the last few months. Every agency is kind of at a different level. Some like Rincon Family Services in Kankakee, they've been open for quite a while. All their staff got vaccines pretty early on because they also have a lot of healthcare services. So they have their doors open and we're seeing people in person. And then we have other folks who have not had the opportunity to vaccine all of their staff. So they're doing appointments. So you can reach out by phone and email and with us, and we can connect you, or you can connect directly with them so that we can make sure you get an appointment. So it varies across the state and it varies across agency, but I'm happy to say that more and more of our agencies are opening their doors now, as they have their staff vaccinated.
Wonderful, thank you so much. And one final question that has come up from lots of folks who call our office. The 2019 public charge rule that Trump put into place, I know has caused a lot of fear among folks wondering, can I apply for these benefits? How will this affect my application for legal permanent residence, for citizenship, et cetera? I know that things are still in the works, but if you could just remind us where folks can get accurate information about the public charge rule and how it could affect their application for benefits, that would be great. And I think we'll end on that question.
Yeah, there's really great news on that today. The Department of Homeland Security has removed the form that had been created under the Trump administration public charge rule. So it's kind of officially official. It's been official since the court made its decision and the Biden administration withdrew their the lawsuit that was pending. So it's been official for about 10 or 15 days, but today actually they took down from the website that form that instructed people, and it was still confusing to many people, thinking that they would have to fill out this very long, expansive form if they were going to apply to be a legal permanent resident. So I just want to mention from the beginning, this public charge rule was really only impacting a very small group of people. But the impact that it had was very, very outsized, because everybody was worried about it. It was on the Spanish news all day long, every day. We got lots of questions about it. Even US citizens, I had numerous conversations with US citizens that were afraid that public charge would impact them. And it really only impacted a certain small group of people who were going to go from being undocumented to applying for legal permanent residency in certain circumstances. So really there was a big chilling effect, and many of you may know that and be aware. But we're just so happy that the Biden administration decided to back off, and that public charge rule has basically disappeared now from, and you can even look on the website, it's gone now. But we're happy to answer questions. We have a public charge working group where we've been working with advocates over the last 2 years. There's a great website called PIF Illinois. If you want to look that up, I can also share. And PIF, there's a PIF National and a PIF Illinois, where many of our partners, Driver Center and the Illinois Coalition of Immigrant Refugee Rights and folks, have been posting regular information on there. And there's like a web portal also to ask questions. So I would encourage people to look at that as well, or contact us directly, especially if you need translation and interpretation assistance.
Lillian, it is wonderful to end this webinar with such hopeful, encouraging news. I am so thankful for your participation. Alam, thank you so much for the information you shared this evening as well. To close us out, I remember at the start of this webinar, State Senator Cristina Pasiones shared, we don't just want you to survive, we want you to thrive in the state of Illinois. As State Representative Guzzardi pointed out, these benefits are here for you. We have a mandate as a state, as your government, to make sure that all of your basic needs are met. This is the work of any progressive, meaningful government, and I am so glad to be about it. But I looked through this presentation, and Alam, when I looked at the income limits you were talking about in your piece, I thought about the times in my life when I would have qualified for SNAP, and I wish I'd had the information to apply. I thought about the times I could have applied for Medicaid. I could have had Medicaid. I didn't have to spend 10 years not going to the doctor. To our neighbors who are watching this now, who may watch this in the future through our social media, don't be ashamed. Don't be embarrassed. Don't be discouraged. Don't be afraid to apply for these benefits. They are here for you. If you're wondering who this is here for you. So please take full advantage of this information. If you need further assistance, you can contact State Representative Guzzardi's office at 773-853-2570. And again, we're so thankful that you watched, you listened this evening or in the future, and we all hope that you have the most healthy, stable, prosperous life that you can. Thank you.
Thank you.